Is it coming?
Yeah, it's good now.
Is it coming now?
Yes.
Yes.
Yeah.
Go ahead.
Okay. So closing an ophthalmic theatre is the most difficult part of any practice, however large or small it may be. So about 60% of our revenue comes from our operation theatre, and closing this is going to be very difficult and crucial for our income. And operation theatre is also a white elephant in our room, and maintaining it without any income is going to be difficult. So what do we do when we go into close down an ophthalmic theatre? It's very important that even when we leave our house, we take care of certain things like make sure the refrigerator is clear, we switch off the gas and all the things. So decommissioning an ophthalmic theatre is also important, and let's see what is to be done. So the first thing one has to do is to make a list of all the inventory in the OT. Or if you already have one, which I believe most of us would be having to maintain in your maintenance register. So I would like to classify the machinery under these broad headings like medical instrumentation, not medical instrumentation, linen management, biomedical, and the most important thing which most of us would forget is the pest control measures. So I made a broad a list of all the things which we have, and every instrument is unique in our practice. So the inventory may vary in accordance to the type of your practice. So however, the aseptic process may not change and remain the same for all operation theatre. One should not forget the pest control measures too when the OT is closed for a long time. Every member should wear a proper personal protection device as shown here, and it is the responsibility of the management to ensure that all staff has the PPD, and the PPDs varies depending upon the level of management according to the staff. The ultimate machine in any of our practice is the phacoemulsification or the vitrectomy machines needs the most important care. See, these instruments have a lot of hollow devices and special care is needed to maintain them. The handpiece should be cleaned as per the protocol and stored in a UV chamber, or they can be packed and kept in a ETO also. See, ensure that the phaco machine is primed regularly and the foot pedal is checked for proper functioning. Adequately dry the hollow instruments before you store them. Also, note the room temperature at which the instruments are stored. As the room temperature varies in different parts of a country, it is important to note that the room temperature is around 20 to 25 degrees Celsius and the humidity should be around 30 to 60. So if you have a temperature monitoring device installed in your CSSD area or a HVAC system which is there in your CSSD area, then things becomes easy. But however, it is very important to check and clean the instruments on a daily basis. Alternatively, you can also store the instruments under a UV chamber during the periods of OT inactivity. Then comes the microscope. Clean the optics regularly and operate the foot pedal to make sure that all the motors are functional. Alternatively, use the spare bulb also in case it has not been functional for a very long time. The storage, temperature, and humidity has already been discussed previously. Most of us would have a laser in our OT. Make sure you fire the laser frequently, at least once in 4 to 5 days. The laser pipe, the light pipe, the endo laser probe has to be ETO'd and stored properly. The autoclave is also very important. Ensure that the water in the tank is drained and it is kept dry. Check all the safety valves, the steam inlets, and the outlets regularly. Make sure that the data in the data logger, if you have one, is already saved because sometimes the battery goes off and you forget to change it. Better keep the chamber open to ensure that there's good aeration. In the case of an ETO or the plasma sterilizer, make sure the gas cartridge is removed and disposed of properly according to biomedical waste norms. The most important is the surgical instrument maintenance. The main aim of storing a surgical instrument is to ensure that they are clean and free of moisture before storing, and also ensure that the moisture doesn't build up during the storage. All instruments has to be cleaned as usual by following the 3-bin technique, dried properly with either a high flow air gun or kept under proper aeration. They are then packed under the trays. These trays are to be then placed inside a UV chamber until they are to be used again. If you do not have a UV chamber, they can be kept open in a well aerated environment. Alternatively, you can also pack these instruments under ETO, double pack them, and they can be stored for a maximum of 6 months or until you use them. Ensure that the storage area meets the required specification as already told before. Suppose if you do not have a UV chamber, see, Place the instruments dry in a well-aerated environment and make sure you clean them once in 1 or 2, 3 days. Medicine storage. See, different medicines have different storage conditions. Note the storage conditions as listed by the manufacturer. Special care has to be taken to all the intracameral, intravitreal, and intravenous medications. The balanced salt solution, which most of us stock, should not be stacked one over another, as the weight of the packs above could damage the ones below. The proper way to place them is always by the sides. All the medicines' expiry date has to be noted, and the medicines which fall with less than 3 months of expiry should be separated and kept in a separate rack. Ensure the storage temperature and the physical parameters are proper. Ensure that the refrigerator should be checked if it's connected to an online UPS, and data logger, preferably which are easily available online, has to record the temperature regularly. So this is the data logger of my refrigerator that records the temperature and humidity every 1 hour. The logging time can be regulated from the software from an interval of 1 minute onwards. The data can be downloaded onto your system every week or as listed by your protocol in your SOP. The spikes in the graph is shown due to the change in the temperature when you remove the data logger and log in onto your system. These kinds of gadgets are very useful, especially during periods of shutdown, where the physical parameters of any closed enclosure like your theater or your CSSJ area can be easily regulated with less manpower. Your people does not go into the theater regularly to record these things. The consumable area or the CSSD area where all the surgical consumables have been stocked has to be cleaned and monitored for pest also, the integrity of the packing and the physical parameters of storage as mentioned earlier. Cleaning has to be done on a daily basis as mentioned in your standard operating procedure. If you have an in-house distilled water plant, make sure during your decommission you cut off the water supply and also dry the water sill if you're not planning to use it for more than 4 days. Do not store any water in the operation theater for more than 4 days continuously. Try to use them for cleaning purpose or any other activity at the earliest. The RO plant, if you have an RO plant in your hospital, however small or large it may be, it has to be cleaned as per the protocol. If you're planning to shut down, empty the tank, clean it with sodium hypochlorite, dry it and seal it ready to be used again. Before decommissioning the plant, make sure you perform the back flush function which is already present in most of your RO plant and cut off the water supply. During recommissioning phase, again clean the water tank, check the filters with the help of your vendor, perform a water quality test as per ISO standards and including your culture sensitivity. Discard the first tank or filter of water and start using after that. It is also a good practice to flush the PVC tubings that run the water from the RO plant to the terminal UV filter to the diluted sodium hypochlorite solution as under pressure. This is usually done by your vendor on request. But however, make sure that the tubings are flushed repeatedly so that there is no residual sodium hypochlorite left, as we might be using this RO plant to clean our instruments and also wash our hands. The OT tables should be checked regularly and they should be cleaned as per the OT standard operating procedure, even if they are not in use. They have to be cleaned on a daily basis. Ideally, if you're closing the theater, you can use or probably clean it once in 1 or 3 days. Special instruments has to be given to the instruments and the furnitures which operate with the motor like your OT table and the chairs. They should be operated and the motors have to be checked once in 1 to 3 days. The anesthesia workstation, if you have one, check the oxygen levels on a daily basis as is an emergency requirements, and oxygen should be available even during your shutdown period. Ensure that the batteries and all the electronic devices are removed, including a laryngoscope. Ensure that all the medicines in your cart are always available even during periods of shutdown. The vaporizer, if you have one, make sure you empty them if you're not planning to use them for more than a week. Otherwise, there's nothing much to talk about the anesthetic workstation. The electrical pendant, the most important thing I would say is you have to empty the humidifier and keep it dry and make sure all the electrical connections are disconnected. The light pendant, if you have, make sure you check the luminosity of the light and ensure they are free of dust and all the joints are freely mobile. The anesthetic manifold should be checked on a daily basis to ensure that the oxygen levels are properly maintained. The wear and tear instrument should be checked on a daily basis. The terminal UV light in your wash basin also has to be checked. Clean the wash basins regularly with soap and water, preferably daily. the air handling unit, which is the most important thing. Cleaning the air handling unit and the pre-filters has to be done as per the hospital protocol. Ideally, they should be done once every month. Though the terminal HEPA filters most of the viruses, unfortunately, the SARS-CoV-2 virus is not being filtered by the traditional HEPA filters because of 0.19 micron size, and our HEPA filters can only filter particles which are more than 0.3 microns. So if you already have a HEPA filter, you have to change the terminal filter to ULPA, that is ultra low particulate filter. But however, as Dr. Nirmal said, wait for the emergency to shut down, and then you can think about all this. And if you're going to change your filters to ULPA, you need to change your blower, because you need to have a static pressure of 150, which is not attained with your traditional blowers. You have to upgrade your blower. And it is also a good practice to install UV lights inside the chamber in both the pre-filter areas. During the non-working hours of your OT has to maintain at a pressure of 2 to 5 pascals with 30 to 60% humidity. The physical parameters can be monitored continuously through an online monitor. If you do not have one, then you have to manually go into the theater and record all these parameters. That's why I told you before, all these electronic gadgets will be very helpful during periods of shutdown, where you can monitor the OT parameters even on your phone from your house. There isn't any change to the cleaning protocol of your operation theater and the furnitures, even during periods of shutdown. They have to be cleaned on a daily basis. However, during the shutdown, you can probably clean it once in 3 days. Suppose in OTs where they don't have an AHU, then the OT has to be cleaned as per protocol. Then they have to be fumigated with a non-formaldehyde-based solution, and it has to be sealed. This process has to be repeated once in 3 days during your periods of shutdown. There's a lot of talk about installing UV lights in operation theater, but I would not recommend it, because these UV lights in operation theater are not validated, as the luminosity at which the microorganisms are killed varies for different organisms. The UVC light, which are usually installed on the walls, seldom reach a lethal level on your tables, not at the floor. But the UV lights work well in a very closed enclosure like your CSSD area or inside an AHU. Install them in your theater is not actually validated. The defibrillator has to be maintained as per your protocol. Charge them and decharge them regularly. This is a very important thing. Check the batteries of an online UPS and operate the gensets regularly, even during periods of shutdown. And these are salient features of take-home message during a recommission. Before starting an OT, make sure you completely overall clean all the OT zones, perform 3 culture sensitivity samples 3 to 5 days apart. All of them should be culture negative. Do a particulate count for your for your AHU. Try to change them to ULPA filters and UV light in the pre-filter chambers if possible. And due to SARS-CoV-2 situation, serology positive protocol in the OT for all surgeries, irrespective of the status. All OT personnel, including a surgeon, should use an HIV or a COVID suit. Cover all your equipments with a sterile cover during the operation to prevent aerosol deposition. And OT cleaning and biomedical waste disposal has been done after every surgery as per the serology positive protocol. After each case, clean the OT instruments, the OT, and change all your personal protective equipments. The biomedical waste has been removed from the theater after every case. The surgical team needs to re-scrub and change to complete PPD, as Dr. Rajiv had said before. Aerosol generating procedures have been done safely with all precautions. Soiled linen use should be packed separately, labeled as BBF, that is blood and body fluids, and personnel handling them should also wear proper protection devices. All the medical waste should be disposed of, and the surgical team should be screened for fever and each every day. Only one case to be operated in an OT. Avoid sharing of consumables as much as possible. Use of disposable is recommended. The minimum staff inside the OT, persons in the OCT should not go outside during the procedure, and separate staff for each zone has to be recommended. Thank you.
Thank you. That was a wonderful presentation, Dr. Kumaran.